Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining us today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have a very special guest. He is a published author, and he's a practicing provider as well. His name is Dr. Daniel Twogood, and on today's episode, we're going to talk about chronic pain and some of the unique challenges that the healthcare professionals face with that. So thank you so much, Dr. Twogood, for being on the show with us today.
Hey, thanks very much for letting me share.
Absolutely. Well, tell us, sir, a little bit about your background and your specialty and what state you're in right now.
I'm in Southern California in the high desert. It's about 90 miles outside of Los Angeles. I'm a chiropractor. I've been practicing 1983, and I learned a few things in practice that I wasn't taught in school about pain, and especially chronic pain, and I thought that would be common knowledge, but nobody else is saying it, so I started writing books about it. And I've written 4 books. The last one I wrote is called Chronic Pain Gone 90 Days. The title is self-explanatory, although it sounds grandiose if nothing else, because basically the definition of chronic pain, chronic any condition, is that it's not going to get better, that you're stuck with it and you're not going to get better. I've discovered that the human body does heal, as we all know, and so chronic conditions and chronic pain are caused by failure to heal. So what I did over the course of years of asking lots of questions is discovered what are the factors that interfere with healing. And once you remove those, then the body will heal itself. And chronic conditions like fibromyalgia, back pain, migraines, all of those things will heal and go away as long as the interference is removed. So that's what I do.
I see. Very good. Excellent. And then I'm sure over the last decades that you've been involved in healthcare, you've seen a lot of changes just in the way that people think about chronic pain. So tell me now, sort of where are we in the United States? What is our view or stigma or some of the background, I guess, where people are stuck in their chronic pain situations?
Again, if you look up any chronic disease, and they'll be able to describe it with great detail in any textbook. However, they won't be able to tell you what causes it or how to get rid of it. And the problem with conventional medicine and even conventional chiropractic, which is my profession, is that we get stuck in a dogma where we believe that the only solution for chronic conditions is medication. That's the conventional point of view. And so when aspirin doesn't work, you go to ibuprofen, then to Vicodin, then to Soma and Norco, and eventually to morphine and the opioids. And as a result of that, we have this opioid epidemic in the country because the only solution for chronic pain is chronic medication. And it's powerfully addictive and it's caused lots of problems. Chiropractors look at chronic pain as a condition that can be treated with adjustments of the spinal column. And by doing that, they can cure diseases. However, chronic cases end up getting chronic treatment, which means that they have to come in forever and ever and ever. So nobody is finding out what's causing these conditions and eliminating them. And so that's what has to be done. And the main reason for that is that if you go to any kind of doctor, the one question they will never ask is, what are you eating? And that's where most pain and disease comes from what we allow into our bodies. And it seems amazing that the medical professions haven't figured that out, because if you go to a medical doctor, they are going to, once they've tested you, they're going to prescribe something for you to swallow. And they know that if you swallow that, whether it's a blood pressure pill, a cholesterol pill, a pain pill, or whatever, it's going to change your condition and hopefully alleviate some of your symptoms. But while that seems like an obvious approach, what they should seem as obvious is that everything else you're swallowing has an effect on you too. And what I've discovered is that while anti-inflammatory medications relieve pain, there are many substances that we consume in foods and food additives and supplements and medications that are pro-inflammatory. And so that's where chronic disease comes from, the fact that we're feeding inflammation rather than eliminating it.
I see. Very good. And I agree with you on a lot of those points. I think there's a gap in the knowledge about some of the chronic conditions. And a lot of times people do assume that a tablet or an injection will provide long-lasting or permanent relief. And that may be the case for some individuals. But oftentimes I have found, especially in the ER, that we have patients who come to the ER over and over and over again because of their sciatic nerve pain, their disc herniations, or other medical issues like diabetes, which we know causes neuropathy, which is a nerve disorder. And so those things, unfortunately, are actually increasing. I don't think there's been a decrease in any of those conditions, at least in my terms of practice. And I think a lot of what you're describing is very familiar to a lot of providers, and I'm sure a lot of our listeners as well.
As far as the normal arc of what people who experience chronic pain go through, the problem with when we look at pain, when we look at physical pain, like lower back pain, sciatic pain, neck pain, shoulder pain, arthritis, etc., that's physical pain. And the assumption by doctors and patients is that if there's physical pain, it's caused by physical stress. That is, you bent, you lifted, you twisted, you worked too hard in a warehouse, you had an auto accident, you had a work-related injury. And then it gets very vague when you can't pin it on any one of those. And you say, well, I must have slept wrong, or some nebulous excuse that doesn't really work out. And so when we're stuck in the realm that we think that all physical pain is caused by solely physical stress, we don't get to the answers. And so what I start with very simple concepts. And the big concept is, number one, is that the number one reason people go to doctors is because of pain. All pain and all disease, in a simple concept, is caused by one thing. And that one thing is too much stress. Not stress in general, too much of it. Let me define stress. Stress is any stimulus that elicits a response. Somebody can touch you and that's stress, but that's not too much stress. But if they hit you on the head with a hammer, that's too much physical stress, and your indicator light of pain is going to come on and you're going to have symptoms. So it's the accumulation of the multiple forms of stress that cause you to break down. And there are three forms of stress. Physical stress we know about is bending, lifting, twisting. Somebody touches you, it's not too much. They hit you with a hammer, it's too much, and you have symptoms. Mental stress is the next one, and that's jobs, relationships, bills. And too many times doctors jump to, if we don't see a physical reason, they say, well, it's because you have a bad marriage, you have a stressful job, you're behind in your bills, et cetera, et cetera. It's a mental condition. Mental stress is one of the three forms of stress, but it's the weakest. The third one is the most powerful, and that's the one that's missed, and that is chemical stress. And what that is your body's reaction to the chemical substances that you're exposed to in food, air, water, skin. Things you absorb, ingest, or inhale are what affect your health. For example, if you inhale cigarette smoke for many years, you're going to have some problems. If you consume alcohol, which is a nerve toxin, it's going to cause degenerative changes and problems. So it becomes more technical than that, because there are lots and lots and lots of substances that we swallow that people aren't aware of that cause most of the problems we have. So I always deal with the physical stress with chiropractic care, and I deal with the chemical stress by diet manipulation. And that is by asking patients the very time-consuming and technical issue of talking about what they consume and how it affects them. It has to be what they're eating, what they're drinking, and the medications they're taking. The newest thing I've seen in the last 10 years is when you talk about sciatic pain, many people come in here with those symptoms, and they are actually side effects to their medication. For example, the statin drugs, which the most popular now is atorvastatin, but simvastatin and Zocor, Mevacor, Pravachol, there's a ton of them out there that as a side effect, they can cause sciatic pain and back pain. And that is never investigated by most doctors. In fact, many doctors don't even ask people what medication they're taking. So medication is one of the things that can cause these problems. But in my experience, most of the substances that cause people to have chronic disorders are in the diet. And they're very specific. Just like if you went to a medical doctor with any kind of a problem, the doctor would test you and do blood testing and all those things, and then would probably prescribe medication. But they wouldn't say, I want you to go take some pills. They're very specific, right? They say, I want you to take this specific pill at this dose, no more, no less. And as a matter of fact, the instructions are going to come from the from the pharmacist, and you're going to follow those instructions exactly. It's very specific. Same thing with diet. There are a lot of general diets out there now that people hope will heal their problems, like the ketogenic diet, the paleo diet, the Atkins diet. They're sort of blanket approaches that people think that, well, if I eat organic and non-GMO foods, I'm going to be fine. I approach it differently. I look at the symptoms, and then I go over what the patients are consuming, and I'm looking for very specific things. And when I see these specific things and tie them to their symptoms in my best guess, then that's how we start, with the elimination of those very specific things. There are plenty of things that you can consume that are unhealthy, but they're not pro-inflammatory and contribute to the symptoms that people are paying me to get rid of. So I start at the top, look at very specific things, and make appropriate changes. And then we expect a response in a reasonable period of time. You don't do this forever and think, well, one day you're going to get better. The last book I wrote is called Chronic Pain Gone 90 Days. If we do all of the right things, symptoms should disappear within 90 days, usually a lot quicker than that. So that's the little different approach I take that I think is the missing link in modern medicine, and that is going over what the patient is consuming and telling them very specifically what to change. There's a lot of general instructions doctors give out, like, if you have high blood pressure, just reduce your salt, get some exercise, and it's stuff you can read about in Reader's Digest. To solve chronic issues for which nobody is finding the solutions, you have to be very specific and very tedious and find out what substances are contributing to those problems and go about instructing the patient how to eliminate them and then what they can expect in a reasonable period of time. So that's my approach.
Excellent. Very good. And I'm glad that you broke it down in those several steps. I think a lot of people, as you mentioned, they go online, they'll find some blogs or some articles about the new diet or the new fad or something along those lines. And all of them do have some benefit, but I agree with you that you have to be consistent in your approach. You have to always be sure that what you're putting in your body is appropriate, safe, and that the doses are correct. And I agree with you that a food is a type of a nutrient that needs to be regulated and very carefully monitored. So glad that you clarified a lot of those points. Now, if we have individuals who are listening today and they want to consult with you, do you have a website or do you have some other social media pages that they can visit?
Yes, I always answer emails. You can always email me my name is Dr. Twogood, and my last name is spelled Twogood, like the number 2 and good. My email address is drtwogood@aol.com. I have several web pages. One of them is danieltwogood.com, and one of them is twogoodbooks.com. Both of them, I have several videos that you can watch where I break down specifically what I do, and you can get actual useful instructions by watching those videos. My books are on Amazon, and you can download them electronically. I wrote a book years ago called Chronic Pain Gone. The newest one is Chronic Pain Gone 90 Days. I also wrote a book called How to Rid Your Body of Pain. To give you a clue of what the specific substances are, the very first book I wrote in 1992 was called No Milk. And then I've written another one called MSG is Everywhere. So those last two titles give you a kind of clue. There's a protein in cow milk and milk products, in fact, in all animal milk products, called casein, casein, which is the most common cause of chronic inflammatory disease, whether it's a skin condition like psoriasis or acne or eczema, whether it's chronic back pain, migraines, etc. So at my approach, what I tell people is the simplicity of my approach is that what we're trying to do is decrease inflammation. So a medical doctor will do it by prescribing anti-inflammatory drugs, the addition of these substances. My approach is to subtract, to determine what are the specific pro-inflammations that are contributing to the inflammation and eliminating them. So again, the American mentality is that if there's something wrong with you, there's got to be something you can take, whether it's a salve, a potion, an herb, a medication, etc. My approach is the human body works best on default. It's built to heal. It's built to be really, really healthy. So you don't need to add anything. You need to subtract. For example, if you were a lung doctor and you had patients who had a chronic cough who wanted a cough suppressant, instead, if you found out they smoked, you would say, listen, for your cough, it'd be better if you eliminate the smoking rather than add a cough suppressant. So my general approach is subtract, not add.
Excellent. Very good, sir. Well, thank you so much for, again, your insight into this condition. And we've had other guests talk about chronic pain, but not quite the way that you've described it. And I think a lot of our listeners are going to get tremendous benefit from hopefully visiting some of your websites and reading some of your books as well. And I'll be sure to send those questions that they have along to you as well. Do you have any final thoughts for our listeners? We have a couple of minutes if you want to give anything positive or some simple tip that they'll remember from today's episode.
Sure. I think that consulting all kinds of doctors is good for information, but what patients should realize is that I tell people when I consult with them, I say that I think that we can get you better. And I say, do you know who we is? We is me and you, the patient. The patient has to have a responsibility.